Healthcare services are created with the patients in mind, right? Would your perspective change if you had limited mobility, couldn't hear properly, had restricted vision, and decreased sensitivity to touch? That's what many seniors experience every day. Experiencing Aging was created to get a glimpse of how we can improve healthcare experiences for the aging patients and their family caregivers. Let's take a look at emergency care. Emergency departments can leave patients feeling overwhelmed and frustrated. This is especially true for the elderly. To demonstrate, we ran 2 simulations in a mock emergency department to highlight many of the challenges. First, we meet Hazel, a typical senior, as she visits the ED after a bad fall. Second, we hear reflections from Dr. Joshua Tepper, President and CEO of Health Quality Ontario, who volunteered to go through the same simulated ED environment wearing the aging suit. To lend us insights as a doctor.
The Aging Suit project was a way of experiencing personally a little bit of what it's like to be elderly, and a little bit not just of what that feels like, but within the context of healthcare, which I think for me felt very real. And so to have, even for a few minutes, a small sense of what some elements of being a patient or an elderly, frail patient might be like was quite profound.
The aging suit imitates many of the physical and sensory challenges connected to aging, chronic health conditions, and disability. It uses braces to restrict joint movement, goggles and earplugs to reduce eyesight and hearing, and special gloves to decrease sensitivity to touch. Let's go back to Hazel and her visit to the ED. First, Hazel and her daughter meet with the triage nurse, who asks her some questions. The ED seems quite busy, and Hazel feels rushed. Once the triage nurse has assessed her, Hazel sees the registration clerk and is asked more questions and given an armband ID. She is then handed off to another nurse who evaluates her symptoms, asking her to tell her story again. Hazel would like to rest as she waits for the nurse to return, but her room is very bright and off a noisy corridor. Seems like it's been a long time, and Hazel begins to get confused as to what's going on.
The guardrails are up, you can't get the call button, you really are stuck in that moment. And if you were in pain, if you had to go to the washroom, if you were confused or upset about something, and you hear noises in the hallway, is that going to relate to your care or not? And it's overall not a pleasant experience in many facets, physically and sort of emotionally, a bit of anxiety or worry. What I think I can take away from this, just those little things about putting the call bell in a place that's visible and accessible. Giving somebody the controller for the bed so they can adjust it.
Finally, the doctor arrives. Once again, Hazel explains what's happened to her. The doctor leaves. The nurse returns to take her vital signs. Hazel's taken to get an X-ray. The doctor and specialist arrive to give a diagnosis. The doctor seems to be in a rush, and Hazel can't understand what they are trying to communicate.
I often stand at the bedside in the emergency room, and I appreciate now that a lot of the time it might be hard for certain people to actually physically turn to see me effectively, and I need to drop my body height, sit on the chair, sit on the bed, so that they can physically just make eye contact.
And caregivers around you, as you will.
The entire process can be overwhelming, with many people coming and going, especially when they all seem to be dressed the same. Joshua's reflection from his time in the aging suit reveal an experience that was similar to Hazel's.
The Aging Suit project is a really sort of thoughtful experience and experiment, if you will. You do come away with a better sense and some better insights, both into the experience of somebody who's older, but also how our healthcare system isn't always physically structured or through communication structured in a way to best meet people's needs. But what I really need to take away from this experience is let's actually bring people more into the conversation and bring in elderly people and say, what are your experiences? I've gained a little bit of insight, but I really now need to hear from you.
Offering elderly patients non-slip socks, walking aids for mobility, and a warm blanket will increase their comfort level and demonstrate sensitivity to their needs. Offering family members pagers gives them the freedom to leave the ER to eat or make a call. Many older people experience hearing loss, and busy spaces with considerable background noise can make it difficult for even the best hearing devices. By offering a pocket talker, using a walled room to converse, Or by grouping patients with similar profiles, you can create a better care experience. The seniors area can have headphones available and TV with captions on. They may also find comfort in being with other patients facing challenges similar to their own. These challenges that seniors face are representative of issues we all face with the healthcare system. Many healthcare organizations are already addressing these and other challenges, but it's important to take action system-wide. By experiencing what the patient experiences, we can see that even small changes can make a big difference, resulting in less frustration and lead to better health outcomes. To do your own reality check or to learn more, visit experiencingaging.ca.